You know, as kids get older, it's time to start thinking about braces, and you may have some questions about what's best for your kids. And here now is orthodontist Thomas Lee from Premier Orthodontics in Thousand Oaks. Good morning.
Good morning.
Thanks so much for joining us.
Thanks for having me.
I have to tell you that I have a 12-year-old son. I took him to a birthday party yesterday, and there was only one boy at the party who didn't have braces. It seems like everyone has braces, but how does a parent really know when their child needs braces?
Well, many people think that, you have to wait for all the baby teeth to fall out and all the adult teeth to grow in before you consider orthodontic treatment. However, the American Association of Orthodontists, they recommend by the age of, to have an evaluation by the age of 7.
Okay, wow.
Yeah, because at that age, some of the adult front teeth have grown in, the molars have grown in, the adult first molars have grown in. And we can detect any kind of any severe crowding, any jaw discrepancies that we can address at an early age that you can't do it when they get older.
Now, and I also noticed that sometimes you see young kids with braces, they get them off and then they have them again. There's like a 2 series kind of thing. What's that about?
Correct. So as I was describing, at the age of 7, we can detect certain things. So we'll kind of intervene early for these certain situations, and they'll benefit from it. So we only address certain issues early, and once all the adult teeth grow in, that's when they go into that second phase of treatment to align all the adult teeth.
Okay. Now, there's a question here about lesser known benefits of braces. Are there some benefits that most of us don't know about besides straightening the teeth?
Sure. With braces, many of us think it's just straightening the teeth, which is beneficial for self-confidence and self-esteem. However, with an ideal bite, when we position the teeth properly, the function of the teeth are better, the longevity of the teeth are better. And you have less chance of a TMJ issues.
We have a before and after picture. Is this an overbite? I mean, the teeth look pretty straight to me, but then again, I'm not a dentist or orthodontist.
So the before picture, you can see that canine tooth on the patient's left side, the right side of the screen. That tooth is sticking out, and again, this is a limited view. So from this shot, you can see that tooth isn't aligned.
Okay.
There, yeah.
And I also wanted to ask you, I mean, there are a lot of different kinds of braces now.
Sure.
Now kids don't get headgear like they did when I was young. But there are some other, we know about the Invisalign and some other things. I mean, what options are there?
So there's the traditional metal braces that many of the teens still choose because, their friends have them and whatnot. The more aesthetic options that teens are more I guess aware of nowadays are the white ceramic braces, but they're still stuck on the teeth. But the Invisalign clear aligners have become a very popular options for our teens.
Well, really? They're okay for the younger folks?
Absolutely, and they work just as good as braces for most cases, from simple to complex. And it lets them live their lives like normal. They don't have the food restrictions that people with braces have. They can brush and floss like normal.
Okay, because that is a problem when you have these, that it's hard to keep the teeth and gums really clean. Is that right?
Sure. It takes more effort with the braces on. You have to brush and floss around the braces and the wires. Versus Invisalign clear aligners, you take them off. You don't have the wires in the way. You don't have the braces in the way. So it's easier to keep clean.
And real quick before we let you go, what foods do kids need to avoid when they're wearing those braces?
Oh, the fun stuff. Anything hard, sticky, or chewy, we recommend because it can knock the braces off their teeth, and if they're not on their teeth, they're not working. So you got to avoid those foods.
At least for a couple years, at least.
That's right. That's right.
All right. Thank you so much, Doctor.
You're
we
welcome.
Certainly appreciate your time. And for more on Premier Orthodontics in Thousand Oaks, just go to our website, kcal9.com, and click Seen on TV.